Hi, my name is Paula and I'm a new mom. Thank you for joining us on our podcast, Bringing Baby Home, with Alex, Vanessa, myself, and Bianca. You certainly heard the different experience that we all went through when we each brought our children home for the very first time. Today, I'm joined by Tanya Hobbs, registered nurse, certified in perinatal care,
That's
correct?
right.
I have to get the hang of it, and a birthing coach to talk about each of our different experiences and, you know, kind of explain to us how they make sense, really. I know that I shared my story first regarding when I brought my daughter Maya home for the very first time, and just the overwhelming love that I felt for her, and I just started crying because I found out what unconditional love was at that very moment. So I can guess there's something hormonal happening there. Maybe you can like shed some light on, why I felt that way, but it was just a completely uncontrollable feeling that was completely foreign to me.
Yeah. It seems like hormones are the answer to everything, right, in
Yes, well,
pregnancy.
because
Like
that's all we
that's
know,
it
right?
seems like a cop out, but
Yeah.
it is true, right? It really just is true. So yeah, for sure. And I think it's of course there's the physiologic component, right? The hormones, but there's also the social component and the whole motherhood component. And there's this term that I really like called matrescence, which is essentially a word that describes that transformation or the beginning of your transition into motherhood and what motherhood is.
Like a medical term?
I'm not even sure if it's a medical
Is
term.
it
I've
it
heard it.
actually exists?
Yeah, it
Okay,
actually
okay,
exists.
okay.
I've heard it coined by different like perinatal mental health specialists
Okay.
in terms of just describing how we kind of tend to actually over medicalize the fact that motherhood is just a difficult phase, right? And not everything is a pathology, which I think we can get into because everybody
Please.
who was on your podcast had different experiences.
Yes.
But essentially, right, there's the hormones, but there's also just the overwhelming responsibility of taking care of a child, especially if it's your first and you've never done it before,
Mhm.
right? Nobody's ever prepared, no matter how many prenatal classes you take for that feeling of this is a helpless baby that I have to care for
Mhm.
and make sure that they survive and thrive.
Right.
And that overwhelming amount of love, but that also usually goes hand in hand with fear, right? Like, am I
Yes.
doing this right? And I think you had
Yes.
also talked about, you were changing her in the mudroom or something, and then you
Yes.
called you
Yes.
called your friend
Yes.
Vanessa because you're like, "Oh, like, what's
Am I
happening? Am I
cleaning
doing"
her umbilical cord right?
Exactly,
Like, yeah,
right? Like,
everything
all
is
the
questioned.
questions.
Yeah.
So I think it's just, right, when we don't know where to put our emotions, they just come out our eyeballs sometimes, and
Yeah.
that's just very typical of the postpartum period
Okay.
for, I would say, almost 100% of moms, right? Will have those kinds of feelings where they're crying for good or bad, right? But just the overwhelming sensation, right? That there's this huge transformation in your life and this huge responsibility and just such a giant change.
Right. So that's how I felt. I'd like to talk about Vanessa because Vanessa's
Mhm.
story was really touching for
Yeah.
me. Every time she brings it up, it always brings tears to my eyes because I could see that it was difficult for her to talk about when she gave birth to her firstborn, Emma. She was telling us how she would have only dreamt to feel what I felt, and she wasn't feeling what she was supposed to feel or what she expected she was going to feel. She starts out by saying, when she got home with Emma, she asked her husband, like, what have we done? Was this a big mistake? Um, like, we had a life that was just fine the way it was, and now this overwhelming amount of fear, I guess, just like succumbed her. So let's talk about Vanessa and all her feelings and the lack of connectivity that she had
Mhm.
with her firstborn.
So definitely, first of all, because there's a lot to talk about for this
Yes.
particular story. First of all, I think that it's very common for pregnant women or postpartum women rather to have a little period of mourning,
Yes.
essentially, right? Mourning the life that you used to have before you had kids,
Mhm.
because right, you can't, like she had mentioned, like Vanessa had mentioned, I can't just go out and do whatever I want whenever I want. I can't just run errands whenever I want.
You also can't give your kid back.
No, exactly, right? Like, it's the permanence of it is
Yeah,
is
it's scary.
overwhelming,
Yeah.
and a lot of people feel that way, but again, it's this topic that's not really discussed very much, and people don't like to say it because, again, then we feel like we're ungrateful or we don't love our child or which is just not true, right? So it's very common. Okay, and then the second thing that I wanted to mention is that, you even said the wording that you used was she wasn't feeling how she was supposed to feel, right? But what does that even mean, how we're supposed
Yeah.
to feel, right? Of course, as mothers, we expect to love our child, but not everybody will necessarily have the baby be born, put on their chest, and then feel that immediate rush of oxytocin and be immediately in love. For many people, it's kind of it's more of a shock really at first than the immediate overwhelming love like maybe you experienced. Particularly if you've had a traumatic birth
Mhm.
or birth with events that were unexpected or didn't go as planned, that can definitely make it feel like when your baby is born, it's almost like having this little alien on you, right? Like, where did this baby come from? I can't believe what just happened, and a disconnect, right, from your body, from your baby, and that can take many days, if not weeks, for some people to really bridge that and for the love to kind of grow and for that bond to develop. And it doesn't always mean that there's a problem per se. I definitely think that there were some elements of Vanessa's story that did point towards postpartum depression, which is an actual diagnosis, if you will. It's part of postpartum mood disorders. But I think just in general, I don't think that anybody should necessarily panic if really all they're feeling is that they don't have that immediate bond, right?
Yeah. And I think that she touched on, the guilt, because she was feeling this way, she felt guilty, like there was something wrong with her. And I think to your point, it's also because of that lack of information that people don't know that, you don't just exit a baby from your vagina or your stomach and you put it on you and automatically the overwhelming love is there. We will see in another podcast where she talks about her birth, and like you mentioned, it was an unplanned
Mhm.
C-section. So to your point, that did affect, I think, also her postpartum and her connectivity with Emma, but and also shows that in her second pregnancy, when she gave birth to Alice, that she felt everything that she expected to feel.
And it was a different context, right? From my
Correct.
understanding, right? Her birth went differently. It was a
Yeah.
planned C-section. She probably had more time to adjust to her thoughts and her emotions about the birth that she was having. So
Correct.
that's for sure a factor.
And so my question to you is, Vanessa, when she was feeling all these feelings, and she was one of the first to have a child in our group of friends. So I guess it was a little bit difficult for her to call someone because not everybody had children. So, what advice would you give to her in that period of time? Like, should she have contacted like a doctor? Because postpartum depression isn't something that you like self-diagnose. It's not something that you're gonna like take care of your newborn and start Googling. So
Mhm.
what tools do you think um, could have been given to her to make things easier, or like explain to her what was happening?
So definitely the number one thing is to express first of all what you're feeling. So whatever's in your head needs to come out, right?
Like just in general,
Just in
to
general.
her husband or her friends,
Exactly.
anybody. Okay.
Just to somebody because when we keep all of it inside and it kind of festers and then that's when things can actually get much worse. So I'm not sure don't really remember if she had verbalized so much like her thoughts in terms of well, I think she did, right? Because she
She
mentioned to
did,
her
yeah. To
husband,
her
like, what
husband
have
and
we
her mom, I
done?
think knew. Yeah,
Exactly.
yeah,
So I
yeah,
think kudos to her for doing that
yeah.
because she didn't necessarily it doesn't sound like she let maybe the guilt or the discomfort of saying those kinds of things that we maybe wish we didn't think. She
Right.
said them out loud to her family
Yeah.
members, which is really important. And for maybe those who aren't so able to be forthcoming with their thoughts, that's where your own family and your support system or your partner um, can be that person just in terms of the observer. So when I give prenatal classes, I always when I'm talking about the postpartum phase, I like to involve the family members or the partner and say, listen, it's not always easy for the postpartum person to be the one to
Advocate.
really advocate and to initiate the conversation about the mental health. But if you, as the family member or the friend or the support person, notice that your friend or your family member is struggling and there really is a break or abnormal behavior that really should be addressed, for you to be comfortable, right, in a loving manner to bring it up and say, hey, Vanessa, I think this is probably something you should bring up to your doctor. Would you like me to make an appointment with you? Would you like me to go with you? Is there anything you want to talk about? Right?
Hmm.
Questions like that.
Hmm.
That should for sure be destigmatized and it is really important and is often the first step towards getting help is just admitting that you don't feel your best and that you think that maybe there's a little bit of help would be useful or
Right.
helpful for you. So that would be the first thing. And then definitely there are a lot of community resources now that offer outreach for postpartum depression. I think it's mental health in general, right,
Mhm.
is more and more up and coming, if you will,
Yeah.
in the medical community and
Yeah.
in topics and conversations in the medical community. So definitely to mention to either your family doctor or your OBGYN. And if you don't want to wait till that 6 week appointment, which I could go on a tangent about that, right? That it's so long after birth. But
Yeah.
and if you don't have an easy access to a physician, then you can talk to people as easy as your pharmacist. Local pharmacists often will know resources,
Yeah.
and there's a lot of stuff online. I actually have some. I wrote them down because I thought that it may be useful for some
Sure.
people. So,
Please.
in terms of what you can actually Google as the postpartum person or as a family member,
Yeah.
there's Postpartum Support International. So, if you
Okay.
just Google PSI, you can go and oftentimes you can just fill out, there's like a form, and then somebody will call you back within 48 hours
Okay.
to offer a helping ear, to
Okay.
maybe connect you with your local resources.
Right.
A lot of people with their employers will have, I don't know if you've heard of these employee assistance programs. So some jobs, they tend to be, higher income jobs, but still, many employers will offer via HR these phone lines where you can call and be connected, if not with an actual psychiatrist or psychologist, with a counselor, with somebody who can take a listen to your situation and refer you to the best places that
Mhm.
can help you.
Mhm. Mhm.
Again, this is when you have a difficulty
Yeah.
coming in contact with your healthcare provider, because we know that that's an issue, unfortunately, where we live in Quebec. There's also Canadian Mental Health Association, and so if you Google that one, there's availabilities there. I know just locally, the West Island Women's Center has support groups. There really is a lot of things. You just, if you're in it and you're not thinking about it and you're not Googling it, it's hard, right?
Mhm.
So one of my number one tips for prenatal, right, even before you get to that postpartum phase, is Google it before,
Yeah.
right? Like when you're pregnant, like I can't say enough for prenatal classes, but taking just a couple of minutes to think, listen, if I do end up struggling postpartum, where could I go? Right?
Okay.
Because the worst is when you're in it and you're just, you don't have the mental energy or even maybe the thought to look up those resources. And
Right.
maybe nobody in your environment knows about the resources. So even if you just have that information somewhere on your fridge, there's a huge section on all the different phone lines you can call at the back of the Tiny Tot to Toddler.
Yeah.
I'm sure you've heard of it, right?
Yes, I
It's like
have
our
it.
baby
Yeah.
Bible
Yeah.
that healthcare professionals offer pregnant women. There's a lot of hotlines back there that you can call. So
Mhm.
there is help. It's just realizing that you need it and
Yes.
and not feeling guilty for calling, right? That's what
Yes.
the hotlines are there for. And it's really important, right? It's just as important as your physical health. If you
Mhm.
feel like you're struggling, if you feel like you're having negative, intrusive thoughts, that your functioning is being affected, then you should definitely look into some of those resources.
And my Vanessa's mother, I know, always would tell her like this would pass, and I think that was really nice and very true in a lot of situations because you don't necessarily see the light at the end of the tunnel.
Mhm.
And I think that the guilt can overwhelm you, and it sounds like for her, she was in a place that she didn't think she would be in. So I can appreciate googling prenate like before birth and trying to prepare yourself, but you know, I can only speak for myself. You never think it's going to happen to you.
Mhm.
So preparing yourself before, I think, can be difficult. But again, when you're in it, it's also, I think, twice as hard to identify
Mhm.
l- that what you're feeling is not, normal,
Mhm.
um, in brackets. Um, so I just want to like move on to Bianca because her experience was completely different, like the complete opposite, which
Mhm.
I've never heard of before.
Mhm.
I mean, I thought like she had an epidural that went wrong or something, but clearly she had a like a help me out here.
So
Like
based on
no
what,
no drug birth.
yeah, so an unmedicated birth.
Thank you.
Yeah, or some people will call natural, but essentially
Natural
means
birth, right? Yes,
unmedicated.
yeah. So what is up with that? Why did she
Yeah.
experience this like euphoria? Is that common? Like what happened there?
So I actually did a bit of research on this as well because
Okay,
it's not very common,
okay,
right? So a lot of people hear about the postpartum blues, right? And we
right.
can talk about that in a second.
Yeah.
But apparently there is such a thing called the postpartum pinks, which
Okay.
is like cutesy
Yes,
opposite, I
the
guess, of
color.
postpartum blues,
Yeah.
which is the lay term, I guess, for post-birth euphoria. So I'm not necessarily surprised that she had an unmedicated birth because I had definitely heard of, women who go without an epidural, without any medications during their childbirth will have very high levels and surges of hormones like oxytocin, which is the love hormone, which is also the hormone that causes contractions. So they get very, very high levels of those hormones, which can give you an amnesic kind of high, if you will, where you're kind of like in this just crazy love bubble. Definitely heard of that and seen that. You're also, when you have an unmedicated birth, tend to have very high levels of endorphins, which are the natural opioids, if you will, narcotics that your body releases naturally
So
to
cool.
cope with the pain. It's very cool, and that can last for hours after birth. But I hadn't necessarily heard that it could last days after birth,
Right.
but apparently it can. So, the whole story about her, being in the shower
She
and
became her son,
yeah, she became her
going through the
son.
birth canal.
Yeah, it's pretty loopy, right? It sounds a little crazy, but
Yeah.
it's very interesting and again, right, the answer to everything, it sounds like it's probably,
The
hormonally
hormones.
hormonally driven. And definitely don't think that that's, there was anything that was
No,
a
no,
red flag in that
for
story.
sure.
But I did read up on the postpartum pinks, and for people who continue to have those kinds of episodes for a prolonged amount of time, it is actually worth mentioning to your doctor.
Okay, why?
In some situations, right, if you end up having symptoms like she was talking about pressured speech, which is when you're kind of rambling and
Yes.
talking super fast.
Yes.
If she had said something like, I was also not able to sleep when my son was sleeping, or you're feeling almost kind of like a manic episode where
Right.
you're feeling disorganized or restless or needing to be very, very productive, not able to sleep or have your normal functioning, then that can actually also fall under the umbrella of postpartum mood disorders, like a
Ah,
prolonged phase of mania, essentially. It's
wow.
very rare, but I thought it was interesting when I was reading up about it. So
Wow.
definitely not concerning if it's like an episode a day or two, a few days.
Yeah.
But if she had felt like, again, she's not able to sleep, not able to function, or her family members again noticing that, okay, there's something really off here that's lasting more than a little bit, worth also mentioning to your healthcare provider.
So what you're saying is it's because she had a, like, unmedicated birth that she experienced
Perhaps,
that. Yeah.
perhaps. Again,
I
with
mean,
a
yeah.
lot of these mental health things, right, we don't have a clear-cut answer as to
Yeah.
why exactly,
Yeah.
but it sounds like it was probably a contributing factor
Wow.
that she had maybe very high levels of these pleasant side effects of these hormones that get released when you have an unmedicated birth
Wow.
in many instances.
Have you seen this, like, a lot in your
I would say a whole lot. Again,
Okay.
because I used to work in a tertiary care center, we saw a
Right.
lot of high-risk pregnancies,
Okay.
quite a high epidural rate at the hospital I was working at. But I'd seen also unmedicated births, and there really is it's its own world and its own kind of subcategory of birth, if you will, that can look quite different from a birth with an epidural, for example. The cascade of hormones that happens is really very intriguing and can have some really interesting effects.
Okay. So to look for if it had lasted, like, longer than a couple of days,
Yeah.
that can also be a red flag.
Mhm.
Interesting. Wow, I did not know that. When she said that, that was the first time I've heard of something like that, and I was kind of envious of her, because the postpartum blues is, when you bring your baby home, you're kind of feeling a little
Not
a
so
little
fun.
low, yeah, and she's there going like, it's all good. So I was a bit
But again, right, and they had brought this up, she had had a very difficult
she had a very
pregnancy,
difficult
right? A
pregnancy.
miserable
Yes.
time for months and months,
Yes.
and now having that weight lifted of that
Yes.
terrible illness,
Do you think it has
that
something to do with
I'm
it?
I'm sure that also contributed,
Okay.
like feeling like now I'm weightless. I don't
Yes.
have this heavy burden.
Yeah.
Like I feel so good in my body, right? The whole like spine thing in the
Yeah.
shower.
Yeah.
So I think that probably was also a contributing factor,
Wow.
which is interesting, right? Because it's almost the opposite of what Vanessa said, who said she
Yes.
had a lovely pregnancy where
Yes.
she's feeling well and she feels attractive and mentally sharp and all these
Yeah.
things. And then she gave birth and it was almost the opposite, right? And all of a sudden I don't feel so good. And
Yeah.
it's the pendulum kind of swung
Swung
the
the
other
other
way.
way. Yeah.
So it just goes to show that everybody has a different experience with pregnancy and postpartum, and none are right or wrong. And all of them tend to have pros and cons.
Yeah. Wow. That's so interesting. And then lastly, Alex, who we found to be quite balanced,
Mhm.
in her when she brought her first back home. But she mentions that she didn't have the language. She didn't know um, how to express her feelings to her husband. Untouched wasn't a word, and the word overstimulation or stimulation in general was not very known at that time. She had her first 8 years ago. So, she was talking about noise and hearing and crying, and all these triggers
Mhm.
were happening and kind of making her feel uneasy, where she needed to kind of step back for a
Mhm.
little bit, and I could completely relate to that because, that still happens in my head. So why does that happen?
I don't think I have a good answer for
Yeah,
that.
yeah,
There perhaps is a hormonal,
yeah,
part of that, but I
yeah,
think it's a normal human reaction, right?
yeah.
If you feel like, particularly after you give birth, a lot of people feel like your body is not your own
Okay,
anymore.
okay.
Like you use your body to feed your baby wants to be on you or near you all the time, right? And that's something that tends to be very specific to mothers, right? Of
Yes.
course, babies appreciate being held by any adult really and having that safety, but the bond that newborns particularly have with their moms requires you to be with your baby all the time.
Yeah.
And I think it's just a normal human reaction to feel overwhelmed and tired and like I need some time just to myself
Mhm,
where nobody needs anything from
mhm,
me.
mhm.
I think it's just in my personal opinion,
Yeah,
is that's
I
it's just a
agree.
normal human reaction,
Yeah,
right? Be interesting to ask like an actual therapist about this, but
yeah,
again, I don't think that that's has anything to do with any pathology. I think that's most people will just feel like that at some point,
yeah,
right? Overwhelmed and just sometimes too much is just too much,
yeah,
and it's okay to take breaks,
yeah,
right? When you need,
yeah,
uh, particularly if you have a support system, if you have a partner, it's okay to hand off the baby sometimes when you
yeah,
need just 5 minutes to just lock yourself in a room and just sit in quiet.
yeah. I remember as a first time mother, I had a lot of trouble with that. I had a lot of trouble just handing off
Yeah.
my baby, just the physicality of it. I didn't want to hand off my
Hmm.
baby. I remember for my second, my husband had asked my mother-in-law to come, like without asking me.
Uh oh.
And but he thought he was doing something nice for
Yeah.
me. I mean,
Yeah.
poor, he didn't know. And he was like, "Oh, my mom's here. You can hand off the baby to her while you take a nap." And I'm like,
Hmm.
"I'm not handing off my baby to anybody." Like that just alone was
Hmm.
just not something that was going to happen because she was too little, and I
Hmm.
thought I was the only person in the world that knew how to take care of her.
Yeah.
So,
And that's also quite common, I
yeah.
think. And in that kind of instance, right, if you do have a support system or a mother-in-law or whoever in your life who's willing to help, then it's also important if you're able to and you have that relationship to verbalize what it is that you need,
Yeah.
right?
Yeah.
So today I am overtouched and I just overstimulated and too much noise. I will gladly hand over my baby, but
Yeah.
maybe for somebody else it's no, I need time to do skin to skin with my baby. What I
Yeah.
really need is somebody
Water.
to cook me a
Yes,
meal,
exactly.
right? Or somebody to fold my
That's
laundry.
exactly it.
So,
Yeah.
in terms of the postpartum period, kind of having again these conversations prenatally, if you think of it or if you have the time to, setting those expectations, those boundaries, those really expectations is the key word with your partner, particularly with your family members, in terms of, um, you know, what is it that will be you believe to be your needs postpartum, and see who is available in your life to help you.
Yeah.
And of course, you need to be flexible because after you give birth, you're not, maybe you thought
Yeah.
that what you would need would be somebody to hand off the baby, and
Yeah.
after giving birth, actually, no, I would rather keep baby with me all the time. So it really depends, but having conversations prenatally with your support system going, no matter what happens postpartum, I love you all, right?
Yeah.
And nobody should take offense to anything.
Right.
We're just it's a difficult time and it's an overwhelming time and we appreciate visitors and we appreciate help. And some days it might look like something and another day might look like something else.
Yeah.
It's just kind of a side note, I guess.
So, and on that point, Alex had touched on visitors
Mhm.
and how, well, I had my first during the lockdown, so there were no visitors.
Ugh,
And then I guess that kind of set the tone for the second, quite frankly. I don't think really anybody asked to come and visit, but again, she had her first 8 years ago, so that was a period of time when people were at the hospital with
mhm,
you or coming to visit. It was a
yeah,
thing,
yeah,
and in her community, it was also quite known to do
mhm,
that. So she was sharing with us how, she had to set her boundaries and tell people, like, you cannot come visit. And people got mad.
yeah,
People did not understand that. And I was surprised to hear that it was people with children. I thought it was only single people who didn't get that.
yeah,
Single people with no children.
mhm.
But I mean, what's up with that? Like, why can't people? I mean, I know that you don't have the answers, but like, I just think that, the whole visitor piece is such a big piece. Like, it's
Mhm,
so intrusive. Like,
mhm.
do they not remember what it felt like to bring a baby back home for the first time?
Yeah. It'd be really nice
It's not
if
like buying a pair of shoes
yeah.
or like buying a new house. Please come and see my new living room. Like, it's not
Yeah,
like that at
no,
all.
it's not at all. And it'd be nice if everybody on the planet understood,
Yeah.
you know, what a transition phase the postpartum period really is and
Yeah.
how everybody does have different needs
Yeah.
and that first time parents in particular, you're in survival mode, and all you need is grace and patience and for people to be understanding. And it's just unfortunately not the way it is for all families or all people. Wish that it was. Not sure there's a whole lot. For visitors though,
Yeah.
I was
Yeah.
like,
Tell me.
I'm as a nurse, I have some thoughts on that.
Please.
So in the hospital particularly, right,
Yeah.
like Alex's story of how her in-laws kind of showed up unannounced,
Yeah.
that's a bit mind-blowing to me. But definitely use when if it's a hospital situation,
Yes.
use your nurses as resources.
Yeah.
I don't know a single one of my colleagues or any nurses who would not be more than happy to kick out family
Yeah.
members if they're not welcome.
Right.
Right. And we're very happy to come up with reasons, right? It's feeding time, she's tired, it's time for medication, whatever it
Yeah.
is.
Yeah.
We have that authority
And
as the
yeah.
healthcare providers
Yeah.
to decline people from coming into the room when it's not appropriate. So definitely, right, you can use your nurse and say, "Would you mind?" And most nurses are very happy to do it. If people literally show up to your room, you can come up with a code word with your postpartum nurse or your labor nurse and say, "If I say this word, it's time for them to go." And then all of a sudden, the nurse will be like, "Yep, it's time for XYZ intervention. We need family members to leave for the moment, please." And then in terms of visitors, once you're home, I like to tell all my clients, right, if you want visits to be limited, stay in your PJs, right? Stay in your PJs or your loungewear. Most people tend to be, less comfortable overstaying their welcome if somebody clearly looks like they're in their PJs. If somebody's going to come visit, right, it's totally appropriate. Again, depending on the kind of support system you have to fine. If you're going to come visit, then for today, the visit will be from 11 to 1.
Yeah.
That's what we can do for today, right? And know that it can change last minute if we're tired, if baby's fussy, whatever. And while you're at it, would you mind, right, stopping by and getting a couple of groceries or
I could never.
right? Like, but it's hard. But
I could never.
But for some people, it is possible.
Yeah.
And to also use your partner, right? If that's the
Oh,
kind of
yeah.
relationship you
Yeah.
have,
Yeah.
if you're uncomfortable as the postpartum mom, right, asking for these things or feeling again like why do we have this as women, right? The guilt or the discomfort in asking for things, then we can also ask our partner,
Yeah.
right? Like this is your mom, this is my
Oh
mother-in-law.
no, that's
like
exactly what I did. Oh yeah.
it's your responsibility, it's your job to manage that and
Yeah.
navigate the visitors. So come up with a code word with your partner.
Yeah.
Like if you're tired, you want to go breastfeed, you want to go nap, whatever, and it's time for visitors to leave, then
Yeah. And it was fine after
code word
that.
comes out, and
Yeah.
then time for your husband or your partner to say, okay, it's the end of visiting hours for today.
But you know what I find crazy on that point is that the mother, or at least I, just to do those things, to breastfeed, to sleep, to eat, to, care for myself or my child, I would constantly apologize.
Why do we do that? Right?
You know what
That's
I
such a-
mean? Like, I don't know if it's a postpartum thing or if it's a woman thing or if it's a social thing, but, if someone's visiting or if I'm even somewhere else and I'm breastfeeding and, we're constantly apologize. Oh, I'm so sorry the baby's fussy.
like it's your fault somehow.
It just entered the world like 5 minutes ago, but like, I'm so
Yeah.
sorry. It's crying. You know what I mean? Like,
Yeah.
it's just, it's fucked up. Like, I
Right.
don't understand. I mean, I don't
Right.
understand why I did. I don't know.
It's like a reflex. I think it's probably a societal thing. Like we're raised not to want to bother people.
Yeah. Yeah.
But you're raising a human.
Yeah.
It's unpredictable. Babies are fussy. You
Yeah.
need to feed them when you need to feed them,
Yeah.
and it is what it is, right?
Yeah.
So it's tough. You have
Yeah.
to, I guess, develop tough skin as a mom to have to go through those kind of unpleasant episodes where you feel like your baby's making people uncomfortable or you're making people uncomfortable, but you're just doing your job as a mom.
And you know what I would have liked, and I don't know if this is something that you provide with your services, but what I would have liked before I gave birth was a heads up on the things that could happen,
Mm-hmm.
whether it be postpartum depression. I knew about postpartum depression, but what to look for,
Mhm.
whether it be, morning sick, like hyper HD, or like whatever, just like a checklist of, and I know that you can't, hypothesize the
Mhm.
planet. I get that.
Mhm.
But just like, what to look for in certain situations, even visitors,
Mhm.
like just like a preamble, just so that like we enter this world just a little bit more prepared. You know what I mean? And I
Yeah.
don't know who can prepare us for it. I
Yeah.
guess I'm trying to find someone to prepare us,
Yeah.
but you know what I mean? Like I just feel like, if you're gonna be my by like even my nurse,
Mhm.
like the nurse could say something like, use me if you need this, 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 and
Mhm.
this. You know what I mean? I don't
Yeah.
know.
Again, I feel like this is just not a failure, but an inconvenience or an unfortunate part about our healthcare system is, right? Our whole prenatal care, obstetrics, medical system, it's not designed for great patient care, right?
Right.
We only see our doctors for 5 minutes at a time.
Yes.
There's no way we can get all our questions answered. You know, we end up having to go down the Google rabbit hole when we have questions when
Yes.
we're pregnant and we don't know who to turn to, and it's just so much conflicting information.
So who can we
Um,
turn to? People like you.
Sure, right? For people
Yeah.
who can, it's obviously right. It's a service that can
Yeah.
be really useful.
Yeah.
But just in general, I always recommend that anybody who's you know pregnant, planning on having kids, take a prenatal class.
Yeah.
It sounds silly, but it really makes such a difference. When I take on my private clients, I give a whole class just on the postpartum period, and we talk about all these things. Right?
Amazing.
What is a postpartum mood disorder? What might it look like? And I always encourage the families to take classes right together, you and your partner and
Yeah.
whoever is going to be your support system, so
Yeah.
that everybody's on the lookout for the same
We did
things.
those CLSC ones, but they weren't.
I mean, it's definitely better
I feel like
than
it's
nothing.
baseline.
It's for sure basic, but for those who can afford or for whom it's possible to hire a doula
Yeah.
or a birth coach,
Right.
it's definitely that's what
Yeah.
we're there for, right? I know
Because
for
you
my
think,
clients,
sorry.
no, of
I don't
course,
know. I just want to tell you, like, you think as a mom, everybody does this every day. I'm going to do it too. It's going to be easy, blah, blah, blah.
yeah.
But, like, you don't know.
No, you
You don't
don't
know what
know.
could happen to you. You have no idea.
Yeah. And even if everything does go quote unquote textbook, just having somebody, one person, one resource person that you can call, text, go to with your questions can be really invaluable, right?
Yeah.
It can decrease a lot of your stress.
Yeah.
It can help you write these checklists that you're talking about. Somebody who knows what they're talking about and who can support you through pregnancy and birth and postpartum. It's hard.
I
It's
would get a
really
doula if I
hard.
could do if I did
There's
it all
so
over
much
again.
information.
I would.
Of course, not everybody can afford it. Unfortunately, it's not something that's covered by the
Yeah.
healthcare system. Again, why? But it is what it is for people who can.
Hmm.
It's definitely it's literally proven.
Yeah.
Study after study demonstrates that having a doula, having a person there for your birth, for your pregnancy helps literally outcomes, health outcomes, right? Babies do better, moms do better, mental health, physically, everything. So, definitely for people who are concerned about the topics that we're talking about and
Hmm.
who feel like I need more support, I have questions, I'm feeling stress or anxiety, and I'm feeling confused. Definitely that's one of the number one resources you can turn to would be a doula or a birth coach.
Perfect. Thank you very much, Tanya. I really appreciate that. You
Thank you for
really
having me.
certainly shed some light on some topics here and some behaviors that we've experienced. And I hope that you will join us again for another one of our podcasts.
I'd love to.
Thank you.